Hello, my name is Erika Bennett, Director of Marketing at South Georgia Medical Center. And today I'm here with our Chief Executive Officer and President, Mr. Ronnie Dean. And this is the first of one of our video series communication updates that we're going to start implementing to just help keep the community informed. So, Mr. Dean, what would you like to share with us today? What's our current situation like at South Georgia Medical Center?
Well, COVID-19 is on everybody's mind. You know, it is real. And we're doing everything we need to do, we think we need to do to protect our patients, our visitors, naturally our workforce. Everybody's working really hard to be safe and take care of all the concerns in the community. Right now, at this time of this report, we have 5 inpatient COVID-19 positive patients under our care. Over the last couple of days, 2 have been discharged home. We have not had any deaths. And I believe the last report from the Department of Public Health, there are 8 in the county. And that could change, from the time this report is given.
Okay. And in regards to supplies and capacity at the facility, can you update us on that?
Yeah, that's a great question. Our emergency operation planning and supply sequestration process is working at this time. When it comes to supplies, we naturally think about gloves, gowns, masks, and the personal protective equipment that our employees, physicians need when taking care of these patients. And we're well supplied, although we are conserving. We are finding that the N95 respirators are available in plentiful form. Masks of other forms seem to be plentiful, but when it comes to eye shields and gowns, that seems to be where we're taxed the most, because as we take care of more patients, the rate of use goes up. So we're sourcing and being supplied at this time, but tomorrow could be a different day. But at this time, I think we're okay.
Okay. As far as staffing and employee morale, what are you seeing when you're out talking to our nurses and frontline staff?
Well, they're tired. I mean, they're working hard. Let's be honest. I mean, it's very taxing. It's very stressful. We're a workforce of people, and we have homes, and we have our communities we're worried about. And we come here and we take care of everybody in this environment. But I couldn't be more pleased with our people. They've responded to the call to do what's required to take care of each other and to take care of this community that calls on us. But our nurses in the specialty care units that we've assembled, they're doing a really great job. They're in control. They're taking all the precautionary measures to make sure we're safe. All of our people that are at our screening station at Smith Northview, our other campuses that are screening visitors, they're volunteering for more hours. They're doing what's required to implement these policies and practices that are in all of our best interest. I'm very pleased with our workforce. Our physicians have done a great job with clinical protocols, planning for increases in the number of patients. All those plans come from our clinically led team of physicians and nurses, and I'm just very proud of them right now.
Mr. Dean, in regards to our employees and workforce, what precautions are we putting in place or implementing to make sure that our workforce is as safe as they possibly can be?
Well, in addition to the personal protective equipment and making sure we're well supplied, and in addition to how we're organizing our units around isolation and being sure that we have the right environment for the patients to be in, we've also implemented visitor guidelines that are further reducing the traffic of, I would say, unnecessary visitation and appointments into the system. That, obviously is a social distancing move. It limits the amount of exposure, and not only for our employees, but for those patients and their families. So limiting the amount of traffic is a measure. And then from an employee health, we're constantly monitoring our workforce. If you recall, the very first patient that was subsequently diagnosed in a Florida hospital, there were 78 exposures to our workforce. One of those exposures was positive. There were 7 others that were high risk. And then since then, the second patient that came through, there was another 17 exposures, so 95 employee exposures. I'm very pleased to tell you that all of the 95 as of noon today will be outside of their 14-day monitoring window. They either are returning to work or are planning to return to work under the CDC guidelines that have been set forth. Our number one objective is to do what's required to protect this workforce, because it's this workforce that's going to take care of us should we have more COVID-19 patients that we have to take care of.
Perfect. And as far as communication with our public, with our employees, what more are you planning, or do you plan to release so that we can help keep everyone up to date?
Well, every day we're having a what's called a safety huddle, and during that huddle, either I or one of the other execs are giving a very thorough report on our COVID-19 status. So that cascading communication throughout our employees at each campus has been very helpful. But the public is interested in more information, and as a result of that, this type of venue, this video information venue, is one approach to pushing more information out. But we're coming behind that with some online information that'll be about some of the statistics that I've called out. And then we also are developing an information line that will come alongside our screening station at the Smith Northview campus, so people can call in and just simply ask questions. If they can't get through another line, say a Department of Public Health or other available information sites, they can call us. We want to be a partner with the community in sharing vital information that can help them and their family protect themselves and keep from the spread of COVID-19, and two, we want to be community's partner in sharing the good news also that's going on, because folks are getting sick, but there are a lot of folks that are getting well. There are a lot of folks that are being screened, and they're negative, and they're testing. And so all of that information needs to come out in some organized fashion. We're going to do our part to try to push that out. We don't want to be in conflict with any other sources of information. So for example, the Department of Public Health will tell us at noon each day and at 7 each day how many cases are in our county. We'll let them tell that information, and what we'll tell is what we're in control of here at South Georgia Medical Center. Just want folks to know we're very interested in everyone being informed.
Thank you, Mr. Dean. Do you have any additional comments or anything else you'd like to share with our audience today?
To our employees, our physicians, our workforce, thank you. To the community, we can't tell you how grateful we are when someone makes a kind gesture toward our team. There have been several forms of that here recently, and I just want to tell you we appreciate you supporting us while we're preparing to take care of whatever comes. Very confident in this team and what they're capable of doing, and your support matters, and we thank you for that.